I want to be that person that you can trust your grandma to or your mom.
Great-grandma was a nurse, so I wanted to follow in her footsteps.
I wanted a better future for my kids.
I've gone through a lot to get here, and it's what I want, and so I'm not going to stop until I get there.
American Indians in North Dakota and the surrounding states continue to experience major health disparities. In fact, this region has the shortest average lifespan of American Indians in the U.S. And while research-based causes have not been established, many believe this gross disparity is due to inadequate health care. Across the United States, there is a large need for skilled American Indian nurses, and that is most evident in North Dakota. Compounding this issue are the significant healthcare needs of tribal populations throughout the state, and the preference of American Indian patients is to be cared for by those who share similar culture and values.
I chose nursing after having to care for my grandma. She had lung cancer. Being in the nursing home, I'd rather be that person to be trusted to take care of your family.
When I was younger, my grandpa was sick for quite some time. I'd stay in the hospital with him all the time, and I found myself helping him to go to the bathroom and doing a lot of the cares to help him out. And so I got a job in the nursing home as a CNA, and I really found what I liked. But my grandpa led me on that path, and I thank him for that to this day.
My mother had passed away, and it just kind of, I looked at my children, and I wanted to be like a role model to them, and to try to continue on with, to go back to school and continue on and show them education is really important.
I think I chose nursing because I like to help people, and I kind of thought it was a career for me. Like once I took the anatomy and physiology in high school, I was interested. I kind of thought it was interesting.
I mean, there's doctor's offices where you've got the Monday through Friday 8 to 5. There's nursing homes where you get to build a relationship with the older population and see them through the end of life. There's pediatrics, neonates, OB. There's just everywhere. There's so many different kinds. There's different cultures to where you're exposed to all sorts of different types of people, and it's just, the possibilities are endless on what you can do and where you can be.
Where I lived and where Sitting Bull College is, it was like a 45-minute drive, and there's limited daycare on Standing Rock, and so finding daycare, finding ways to get to class, that was my biggest struggle my first semester.
Sometimes I wish that I would have went to school before I had kids, because I have to put them ahead, make sure they're taken care of before I can start my studies. So it's usually about like 8 o'clock in the evening on when I can start doing my homework.
I'm the mother of 3 young kids, so trying to work around their schedule and then have my own schedule now, it's been a challenge in itself.
Time management is really hard. I'm the single parent to a 3-year-old, so finding daycare and someone to watch him when I've got clinical and I have to be in Wahpeton at 6:45 and coming from Fargo, those are the biggest challenges that I've faced in the time management with, do I do my homework or do I play with my child?
I just wanted to be able to give my kids a better future. And I knew that coming back to school as a nurse, I mean, working as a CNA was fine, but I know with 4 children, you needed a little more.
Our class, we're all pretty close, and whenever something goes wrong, like right now my car's actually broke down, but my classmates have all helped me out by giving me rides.
We're like each other's support system, if we're having a problem, we always encourage each other, like, you can do this, I'll help you, what are you having a problem with? Or if you're having trouble, you just ask a couple students, or you know what I mean? And then even they'll be like, well, I'll ask so-and-so for you, and it's just kind of a really good network.
Whenever I'm having troubles, and just want to quit, I call up my mom, and she's like, you're almost done, you're almost done. And then my classmates, we talk about everything.
Not be afraid to ask people for help. So, which was my problem in the start. I don't really like asking people for help. So I'm starting to get to where I can say, I can't do this all on my own.
Like the underclassmen, I try to give them ideas, just like little tricks that helped me get through some of the classes. I'm always telling them that I'm here a couple of the girls come in asking about pharmacology and asking what was like the best way to study. So I mean, I just try to help out.
Ask for help from the teachers if you need it. You know, don't be struggling and not tell anybody, because they're all willing to help you get through this. So, and it can be done, because other people have done it.
Nursing's leaders recognize a strong connection between a culturally diverse nursing workforce and the ability to provide quality, culturally competent patient care. But health personnel shortages can negatively impact healthcare quality through reduced healthcare access, increased stress on providers, and the use of underqualified personnel.
Well, I want to go back to my reservation. They have a nursing home that they're opening up, and then that's where I want to go. Our elders need the younger generation.
All them times where I didn't get to play with my kids or, you know, be there for their activities, I just kept telling myself this is for them.
I haven't heard when people say, oh, I'm so angry at myself for getting this education. You know, it's always the other way around. Oh, I'm so mad I didn't get my education when I was younger. You know, so I'm not gonna have that issue because I'm here, I'm doing it, I'm getting my education. And as far as, you know, trying to help yourself be a better person, you know, help your community, there's no other way to go.
The possibilities are endless on what you can do and where you can be.